question, that is of Vongierk's disease. The Vongierk's disease, that is one of the glycogen storage disorder. So what do you mean by glycogen storage disorder? The name itself suggests that that is a defect in the glycogen metabolism, especially catabolism, which leads to accumulation of glycogen inside the cell. So that's one type of glycogen storage disorder. And the enzyme which is deficient in Vongierk's disease, you must remember, that is glucose 6 phosphatase. It's a not glucose 6 phosphate dehydrogenase, because glucose 6 phosphate dehydrogenase is the enzyme for HM pathway, not for the Vongierk's disease. So please don't confuse with the G6P and G6PD. So this is glucose 6 phosphatase deficiency, and that was glucose 6 phosphate dehydrogenase deficiency. So Vongierk's disease, that is glycogen storage disorder, which is due to the glucose 6 phosphatase deficiency. So now we see what happens when glycogen is accumulated. So here you can see normally what happens, glycogen is converted to glucose 6 phosphate and ultimately it will be converted to glucose. But the G6P is deficient, so patient is not sufficiently producing hypoglycemia, not sufficiently producing glucose. So the patient has attacks of hypoglycemia, because wherever the glucose will be depleted from the body, glycogen has to bring down to the glucose. So patient has deficiency of G6P, and that's why it cannot produce the glucose from the glycogen. The patient have attacks of hypoglycemia. Apart from that, glucose 6P is increased, so it takes the alternate pathways. So glucose 6P will enter into the glycolytic pathway. It ultimately from the pyruvate. Pyruvate will be converted to the lactic acid for the production of lactic acidosis. And apart from that, it may enter into the fatty acid synthetic pathway, because Krebs cycle is saturated, then it has to enter into the fatty acid synthesis. So more TG will be synthesized. So patient is having hyperlipidemia due to more amount of acetyl CoA. Patient is having hypoglycemia. Patient is having attacks of lactic acidosis. And G6P will be converted to ribose 5 phosphate pathway during HMP shunt activation, and ultimately leads to more formation of uric acid. So it's a very complex metabolic disorder. It prevents the formation of glucose, that's why hypoglycemia. It takes the alternate pathway of lactic acidosis. It takes the alternate pathway of fatty acid synthesis, thereby hyperlipidemia. And again it will enter into the ribose 5 phosphate pathway, and formation of uric acid will be increased. So patients have an attack of gout. So remember, 5 things are there. One is hypoglycemia, hyperlipidemia, lactic acidosis, and hyperuricemia. So in question you will see a person with the Vongierk's disease has ketosis. All are true for ketosis in patient except lactic acidosis. Yeah, it's there. Hypoglycemia is also there. Fat mobilization is less, and hypertriglyceridemia is also there. So the patient has an answer of question C. It's my mistake. The answer will be C. It's a less fat mobilization.